After I was done training at the University of Chicago and came to Omaha, I wanted to start something special. What I realized during my training was that head and neck cancer patients, although we're making progress with chemotherapy and various surgical techniques and radiation therapy, that 75% of these patients were presenting late, and we needed to do something about it. So our mission really is education. That's number one, making people aware of this. Second part of our mission is research, in that we raise funds to help find an early cure or better treatments for this. And then the third part is treatment. And we do all of these. It's not just me. It's a group of physicians and support personnel that do this. The Nebraska cancer specialists, particularly Dr. Bob Langdon, Dr. Gamini Suri, have been supportive from day one since I first came to town in 1990. Attention, please. You guys ready? Yeah, we've gone through this stuff over and over again. You guys know all this. We talked about 5 or 6 or 7 causes, and one at a time, who can name me one of the causes? Yeah.
I was very surprised to see that the kids knew all the different causes of cancer.
Are there different kinds of tobacco?
So I think this is something that's really, really helpful.
What other causes of cancer are there?
The kids really retain the information. I believe some of them go back home and tell their parents the information. Through this health class and our dental health class, they have learned a lot.
Some of the goals we hope to accomplish with working with these kids is bringing awareness to health in general. And sure, cancer is a big part of what we do, but just making kids aware that being healthy is a great thing. Part of what's being done at the Wesley House is to try to help these kids grow up and be great citizens, and part of it is just taking care of themselves and being overall healthy. And that's what we're trying to do, just trying to contribute to the program down here.
Like the old saying goes, an ounce of prevention is worth a pound of cure. And we're just so very fortunate to have someone like Dr. Dobleman, who's really a leader in his field. I just really hope that you appreciate this opportunity to learn from some of the best in the field. Thank you, Doctor.
So I think we hope that this kind of work that we've been doing in the community for the past 15 years will have some snowballing effect, even though we only see maybe just 25, 50 patients at a time, but eventually the level of awareness in the community would increase. So we want to do more of that.
We've also been working with Creighton University in doing research projects.
Research is very important for all types of cancer. Head and neck cancer, it is even more critical because it's a disease where still treatment advances really haven't come to fruition to cure a vast percentage of patients. So therefore, finding new treatments, finding the existing treatments in a more optimal sequence is very critical. Now we are beginning to understand some of the basic biology of head and neck cancer than we did before. So once we know what causes head and neck cancer and etiologic factors, then we can try to intervene and not only to try to prevent the disease someday, but also in patients who already have the disease, we might be able to find new ways of treating and getting better results. So it's very critical.
My name's Denise McBride, and in December of 2003, I was diagnosed with cancer of the tongue. Once I got the actual diagnosis and confirmation that it was, then you're afraid because it's so unknown, not having ever experienced that for myself or anyone close to me. It all happened very quickly. I got my diagnosis, a confirmation on Monday, and I was in his office on Tuesday.
Her disease was fairly advanced. She had had a non-healing ulcer in her mouth, and typical for head and neck cancers, they very often masquerade as benign types of problems or things you wouldn't really think twice of.
He explained to me what the road ahead was going to entail.
I think that, it's frightening when you hear the word cancer, because cancer means death. That's what you think about. I have cancer, am I going to die? Particularly with head and neck cancer, you're thinking about three things always when you're trying to help somebody with cancer. Sure, you're thinking about curing them, but if you cure them and they can't speak or swallow or breathe properly, our job's not done. So the second part is function. And then the third part is, let's say you cure them, they can swallow and everything, but they can't go out into public because they're deformed. Well, that's the third part. So it's always in that order: cure, return function, and then you try to do your best to put somebody back together with the help of a team so that they can go out and be with their families and get back into the public and go on with their lives.
I'm cured. I'm 4 years out. I make the 5th year. I only go back for yearly checkups. I feel good. And I think we just don't hear enough about this. Everything is breast cancer. You hear a lot about, or colon cancer, and obviously they're all horrible diseases, but you just hear more about them.